sadness. And this would be something that you could do for yourself, for a patient, or a friend, right? When you're having climate distress, the things you can do are first to validate your fear. Whatever you're feeling, it is okay. It is not pathological. You don't need to shrink for it, right? And because it is a fear that is based on something real, right? It is not a clinical state. You don't want to suppress it, but you rather want to make yourself feel more safe and feel more empowered by taking action. So we work with climate anxiety quite differently than other forms of anxiety. We try to get people connected to communities. We try to get them doing things that will help transform their fear and reduce it in that way. And that practice is really the practice of active hope, right? It's not that you feel hopeful about the outcome, right? You're not trying to feel hopeful about the outcome, but you're trying to be on the Titanic doing what you can do right now to make the situation go well. So it's the hope to do something, right? And as you're doing this for your psychological state, you're also nurturing yourself in a variety of ways. And one of the most important ways is to nurture your relationship with nature. Right, so reminding yourself continually of how does nature take care of me will allow you to feel more easily, what should I do to take care of nature? And it's much more consonant with our early childhood experience. And if you're talking to a friend or a patient, much easier for them to relate to if they're feeling and thinking about being cared for or caring for as they did when they were little with plants and, you know, dogs and cats and puppies and things. Yeah. And the last thing is to try to remember that you don't want to get caught up in disavowal. Right? Disavowal is the state where you're feeling one way, but you're acting another way. You're very distressed about climate, but you got to go to England to take care of something, and you're in tension with yourself, right? And when you notice that, finding ways to bring your climate reality and your social reality more closely together is helpful. Allow yourself to let it matter to you and live with the reality that's most important and most real. Next slide. Okay. The other thing you can focus on in dealing with the psychological states of climate change is to look for self-limitation in some ways, right? So these are principles that come from acceptance and commitment therapy, that we all get stuck, right? Because there's something that we can't accept, that we can't move through emotionally. This might show up as you're being stuck in the past or dwelling in a future reality that might come to be, being stuck in a rigid story about something, or finding that you've in some way fallen away because you're stuck from something that's really important in terms of your core values. You just can't deal with something, so you're avoiding some sort of hard reality, right? And when you're feeling limited in some way, the things you can do to help yourself with it are to sort of make fun of your inner Eeyore or your inner Candide, this like, I can't, or this, everything's going to be fine, don't worry, right? You can use your upset to find out what you really care about. There is nothing more valuable than your anger or your sadness, because it tells you, what do you really care about underneath that? What is the value that is at stake that has been violated in this relationship or the situation? And with finding that value, you can then tell yourself some sort of new story, right? You can also tell that story to other people, right? Saying your climate story out loud, this is how I want to be, and this is what I'm going to do, will really help you to act on it. And particularly the use of I will sentences. Right? You can sort of play around with your own doubt and your own stuckness by making a list of what you don't think will ever be possible for you to do, and then challenge yourself to, how could I get there, right? How could I start to take action on this? Right? And when you want to let go of something, rituals can be really helpful. Right, so you could take all your plastic bags and weave them into a pattern. You could take a picture of it, frame that picture, put it up on your wall, and then do a little ritual to it. Right? And that will help you access some sort of deeper, sort of more primitive kinds of feelings, ways of relating to letting go and moving forward. Next slide. So those are some ways to let go of self-limitation. And then when you're trying to get out of mental collapse, something that we can all feel when we're sort of overwhelmed and exhausted by the enormity of this problem, right? There are a few things that you can use to kind of help with that. We use this expression, metaphor of the baby, metaphor of the infant. What that really means is lowering your expectations of yourself. But if you think about an infant, infants are alert, they are open, they are present, right? And they don't know anything. Right? But they are attentive and able to absorb a lot of information and be very responsive in the moment. And sort of keeping that image of a child that's a very young child who's just sort of really right there and really open can be your image for yourself in these climate situations. You can also try using dialectic, something we wrote a paper about. So flipping from, I feel certain of this, to what would happen if I felt uncertain? I feel hopeless. What would happen if I felt hopeful, right? That can be a way to kind of get out of a sense of being not sure what to do, or trying to come up with new creative actions. You should embrace the uncertainty of the situation. Jonathan Lear wrote about this concept of radical hope. You are an uncertainty cloud. The reality around you is an uncertainty cloud. There is a lot that could change, right, at any one moment, right? And we have found it to also be very helpful when we feel mentally exhausted in processing this stuff, to get really curious about that moment and to slow down. So after like a 2-hour discussion, right, just, I don't want to talk anymore to you guys, right? To think about that, and like to say, okay, let's stop there. Because what you'll find is that at some place in the next 30 seconds, somebody makes a really good joke, right? And that will often turn out to be a joke that tells you what your group next needs to do, or what you next need to do. So that is my 5 cents about how to deal with yourself psychologically around climate change. And I think we'll now go to the next speaker. We're going to stop the slides now.
Thank you so much, Beth. I was having trouble getting unmuted. I hope you can hear me. Next up is Dr. Brenna Doheny, PhD and MPH, who is a postdoctoral associate at the University of Minnesota Medical School, Duluth. Her research involves developing new ways to assess and address rural health needs. And Dr. Doheny serves as executive director of Health Professionals for a Healthy Climate, an organization that inspires and activates Minnesota health professionals to address climate change. Take it away.
Thanks, Mark. Since this session is focusing on education and solutions that we can integrate immediately to address needs for activating health professionals and climate change, I'm going to talk about how we can integrate climate change and planetary health into health professional education, using examples both from my institutional setting at the University of Minnesota Medical School and a community-based setting in work that I do with health professionals for a healthy climate. Next slide, please. And I mean, this is preaching to the choir, of course, because we're all health professionals and suffer from this idea that we don't think we know enough. We work in a field where we feel very inclined to really questioning what constitutes expertise, right? And so one of the main barriers that health professionals consistently report to engaging in action and around climate change is that they think they have insufficient knowledge. And this is reflected in many studies, including at the global level in this Kocher et al. Recent study that was of looking at the six different World Health Organization regions and multiple health professions, and on a more local scale, a study that the Minnesota Department of Health is conducting that I'm involved with that surveyed health professionals. You know, similarly, we're finding that half or more of health professionals think that they don't have enough knowledge to do this. Next slide. So I think one of the important things to start with when we're talking about how can we provide this education to ourselves and to other health professionals is connecting to a larger context, recognizing that we actually already do have a lot of knowledge and expertise in different areas, and it kind of all matters in this context of how do we take action on climate change and think about those health impacts. And a framework that I think is really helpful for thinking about this is the Planetary Health Education Framework. So planetary health, according to the Planetary Health Alliance, is a solutions-oriented and transdisciplinary field and social movement that is focused on analyzing and addressing the impacts of human disruptions to Earth's natural systems on human health and all life on Earth. So it really emphasizes interconnectedness and, you know, even centralizes connection with nature, which definitely is a callback to what Beth was talking about, how that's critically important for our mental health as well. And so thinking about all of these different aspects and really thinking about health in this multifactorial context, I think is really key to understanding how we can engage with this topic. Next slide, please. So as I mentioned, I wanted to talk about examples that I've been involved with in in my own life and work. And one is at the University of Minnesota Medical School, where we're trying to integrate climate change and planetary health into the curriculum. And I definitely wanted to spotlight that a lot of this is being driven by students themselves. And we see that across all the professions, and medical students were featured in their work at the last annual meeting for what they were doing to try to incorporate this into their curriculum. And that's definitely happening at the University of Minnesota. Next slide, please. So I work on the Duluth campus of the University of Minnesota Medical School, and we have a very unique and specialized mission that focuses on rural health and Native American health. And so that was really my focus for talking about why thinking about climate health needs to be part of our curriculum, is that there are disproportionate impacts on the populations that we serve. And that's really been the focus of getting that integrated into what we're teaching our students. Next slide, please. So I was able to this year pilot several sessions that were connecting what students were learning about social determinants of health, thinking about how that influences the populations that they're learning how to serve when they go out to practice medicine, and kind of basing this on what we know about health disparities and unequal vulnerabilities to the health risks of climate change. So this is kind of a composite of what that curriculum looked like that I was able to deliver during the Introduction to Rural Family Medicine and Native American Health unit that our students are engaged in. Next slide, please. So moving from what I've been doing at my institution to directly educate students who are going into health professions, I wanted to talk about community activities that we engage in at Health Professionals for a Healthy Climate that are for everyone really, but kind of focus on engaging currently practicing health professionals. And so we do look at our mission at Health Professionals for a Healthy Climate. We're a Minnesota-based organization that started in 2015 and has been an all-volunteer organization until very recently when we were able to hire our first staff person in November. But we engage in educating and activating health professionals to address climate change. Next slide. And among the programs that we've engaged in and found to be effective is we started what hopefully is, we tried to make a monthly series of what we call climate convos, intentionally informal in the name, where we get together and discuss topics in climate change. Usually we bring in somebody with expertise in that area to share. And oftentimes we focus on bringing in experts from community organizations and environmental justice communities. We initially launched this as also a great social and networking time when we could be in person pre-COVID, and we've moved to the virtual space with that, but are hoping to move back to in-person events sometime down the road, right? Next slide, please. And we were able to partner with other state affiliate groups of the Medical Society Consortium last year on this really excellent series where we kind of took that climate convo model and expand it to look at our Great Lakes region. So I wanted to give this shout out to, I know there's some other members of this Great Lakes Climate and Health Consortium who are on the meeting right now. But similarly, the model was like, let's think about what are our areas of expertise and collaborate and work together to bring this education and discussion to health professionals all across our region. Next slide, please. And finally, we are also planning our own conference, the Code Blue for Patient Earth, which we actually launched the first one of these in 2016 and have kind of continued to build on this model. Ideally, we wanted to have this conference every 2 years. We held a great one in 2018, back in those in-person days. And we had intended one for 2020 and had it all ready to go, but it was going to be in April 2020. Everything shut down. We had to cancel it, but we're bringing it back now, April 2022. And we're really excited about this because we look at all of our educational initiatives, not just about providing this increased knowledge base, but motivating people to action as well. So the topics were very intentionally chosen. The speaker is very intentionally chosen to talk about work that people can engage in right now. Very similar to the session that we're all currently participating in. So if you're interested in more information about that conference, there's the link. We'd love to have folks show up for that and also just talk more about our method of going about to bring this programming to our membership and beyond. Next slide, please. So this is kind of a list to really think a little bit about what can we all be doing right now to increase educational opportunities for health professionals around climate change and health. Obviously, we're all doing it right now by being at this annual meeting, but I think that it's important we all think about fostering a culture of prioritizing climate health education. So think about what you can do at your clinical sites, asking for grand rounds presentations, inviting guests to do that, give it yourself in your area of expertise, all of those kinds of things. Just normalize it into the culture of your clinical site. And what is your professional organization doing to offer continuing education? What are your licensing boards doing? And if you're in university still as a student, like I said, students are really driving change, but if you're an alum of your program, is it part of that curriculum? You can reach out and ask and say they need to be doing it. And then similarly at this community level, there's all kinds of ways to organize educational opportunities. And we need to get over this hurdle of feeling like we don't have the expertise to do it because somebody in your community does. Let's invite them and let's share our expertise and work on this together. So that's what I have, and happy to move on to the next speaker. Thank you.
Thank you so much, Brenna. Our next speaker is going to talk about how to bring these discussions right into the clinical situation, talking with patients and families. So Dr. Andrew Lewandowski is an active community pediatrician and serves as the education co-chair for the Wisconsin Health Professionals for Climate Action. Andrew.
Hi, everybody. Thanks for having me today. And I do want to highlight the fact that I am a community pediatrician. I am not an academician, and I don't have a whole department behind me. And so I want everyone to realize that anyone on this call, anyone on this video conference can do this today. So next slide, please. I first want to acknowledge that the land that I'm presenting from was previously occupied by the Kickapoo, Ho-Chunk, Peoria, Sauk, Sioux, and Miami tribes. Next slide. And so first I want to start off with how I do it. So the way that I incorporate climate change into my clinic with all of my patients is at my well child checks in the social history section. And so typically, and I don't think there's supposed to be animations on the slide, so you might want to start clicking through whoever is. Yeah, just go through until you get down to climate footprint. Great, that's probably good. Perfect, and you can do 2 more. All right, and so this is the social history that I do. The social history typically for me falls after talking about diet and nutrition and pooping and peeing and school and development and all those things. You can see that I have a basic history about where people live and exposures at home. And then in the climate footprint section for the study that we're going to discuss next, I'm going to tell you some counseling that I give in about 45 seconds, but I also want you to know that this has changed over time. I'm just going to give you the counseling that I provided for the survey I'll describe to you. And at that time, I said, in the last 2 years, the American Academy of Pediatrics and over 100 other health organizations declared climate change a health emergency. You know, the air pollution alone caused over 64,000 premature deaths in the United States in 2016. And worsening air quality is only 1 out of 9 ways that climate change is hurting people, disproportionately hurting children. So just like I want your children to eat healthy foods and I want them to be in the right car seat for their health and safety, we now know that decreasing our energy use, increasing our energy efficiency, and supporting clean energy initiatives is also important for our children's health. Do you have any questions about that? And then I ask about discrimination and I move on to the physical exam. Next slide, please. And so what I wanted to know was, is that 45 seconds worth it? So I administered a 7-question survey to 234 patient families with an excellent response rate. And what I really wanted to know is, as a result of the counseling, did they learn more about those climate change related health harms? Are they more likely to save energy or support clean energy initiatives? Did their political identity play a role? And then for any community pediatrician, for any clinical physician, we all know that patients are more than happy to give you tell you how they really feel in a free response section. So I wanted to offer that as well. Next slide. And so along with Drs. Sheffield, Adut, and Maybach, and I cannot thank the 3 of them enough for their help in putting this together. They were instrumental in publishing this. We shared those results. Next slide. And so first, I was really surprised to see the number of people who already said that they knew about climate change related health harms. And you can see in the column, we have prior awareness of health harms, and then we have learned more about climate change related health harms as a result of the counseling during the visit. And while these ends are pretty small, I want you to know that largely this is all a positive response across the board. Next slide. And likelihood of changing energy use behaviors, so switching to LED light bulbs, decreasing energy use, other energy efficiency measures. On a Likert scale from very unlikely to very likely, you can see that pretty much all participants were more likely to try to change energy use behaviors as a result of the counseling that they provided. Next slide, or that we provided. Next slide. And then supporting clean energy initiatives, we can see similar outcomes across the board. Next slide, please. And then the free response section. We identified 4 themes to the free responses. And so one of those themes I want to share is counseling effectiveness. One patient says, appreciate it. We've made changes since having our first child due to information provided. Another one says, we didn't previously realize how it's important stacked up against other child-related safety concerns. It's good to better understand the gravity. Next slide. This says, it was very informative. We already use LED lights in our house. We're getting new windows installed in the next couple of months. All these things that this person's doing. The next person says, it's good to know, change things in our home to make it healthier for our children. And you can see a number of other positive responses here. And it's important for people to realize that the theme for this section, next slide, please, is that they were all conservatives. Next slide. And so I want people to take the leap. I know it feels like a leap, but you don't have to know every little thing about immunology in order to counsel about vaccines. And try to keep in mind that if you go to the kind of the extra or supplemental materials section of the paper and you look through all of the free response section answers, you will see that the most negative free response that I got out of this entire survey was fine, but not necessary. And so I want people to know that my experience is that the climate counseling that I provided did not jeopardize my relationship with my patients. Instead, my relationship with my patients strengthened the importance of my counseling. I don't think we have much to fear with going into this, just like we would counsel about any other medically related topic. And so figure out how climate change is affecting your patients or families. You don't need to know every last little thing about climate change in order to counsel. You just need to know how it's affecting their patients, and you need them to be able to make the connection. So then determine how you want to share that with families, and then you want to practice. I've certainly changed my counseling spiel over time. I would expect anyone else to do the same. Next slide, please. And if you are worried about people getting angry, just remember, you've got this. How many times do we have people who could potentially scream at you about getting an antibiotic for their cold? Or how many times have you thought about, oh my gosh, I have to talk to this family about COVID vaccine recommendations. I'm really worried that because of my assumptions of their political identity or other things, that they're just going to yell back at me about how it's a hoax. It doesn't change that we don't counsel about the COVID vaccine. It doesn't change that we all of a sudden give them their antibiotics. No, you promote that antibiotic stewardship, and you promote the COVID vaccine. And likewise, I would hope that people see that climate counseling is really no different. Next slide, please. So concluding thoughts are that climate change and health can be discussed succinctly in a healthcare setting, that counseling about climate change and health can make a difference, that your title and your relationship with your patients are what make this so important, because they do care about what you think. And we do need leaders on climate counseling in different healthcare settings across the country to effect a change. Thank you. Next speaker.
Thank you so much, Andrew. Really appreciate that practical approach that you shared with all of us. Next up is Dr. Todd Sack, who's a practicing gastroenterologist and the executive director of My Green Doctor Foundation. Dr. Sack is currently a leader with Florida Clinicians for Climate Action and Physicians for Social Responsibility, and has also served on the Florida Energy Commission. Welcome, Dr. Sack.
Thank you, Mark, and thank you to all of you. My brief talk is Climate and Health Solutions for Your Practice, what you can do today. And I ask you to grab a pencil and paper, because I'm going to give you an assignment, a 6-minute one for today. My preferred pronouns are he, him, and I'm executive director of the My Green Doctor Foundation. Colin, next slide, please. I'll just say briefly about me. that I give community talks on climate change and health. If you'd like guidance on that or PowerPoint slides, give me a call. And I help formulate policies for medical societies on climate change and health as well. Next slide. So I'm going to talk about clinics and offices today. And even if you don't work in a healthcare office, you go to healthcare practitioners for care. And so you can talk to them about this. Our US healthcare industry is responsible for 5 to 10% of America's greenhouse gases and air pollutants. And this leads to more than 400,000 years of lost life annually, just to the diseases caused by the pollution created by the work we do. Now, outpatient care, our clinics and offices and outpatient centers are 26% of healthcare's air pollution and greenhouse gases, compared to 33% for the big hospital system. So actually, outpatient care is really up there with the hospitals as a very important contributor to our nation's problems. There are millions of healthcare offices worldwide. There are huge opportunities for us to save resources and money in our practices. But I think more importantly, and I think as Andrew introduced for us, we can influence the choices made by our patients by adding environmental sustainability and climate change to the conversations in our offices and in our waiting rooms. Next slide. There are many resources for hospitals. You all know Healthcare Without Harm, I hope, and their Practice Green Health and Healthier Hospitals initiatives. The American Hospital Association has a similar sustainability roadmap. There are other organizations in Europe and Australia and other countries to support hospitals on topics like eliminating solid waste incineration, eliminating mercury devices, energy use, renewable energy, waste management, greening the hospital supply chain, eliminating or minimizing climate warming anesthetic gases, transportation choices, lots of climate advocacy done by hospital systems now, and advising healthy food choices. Next slide. But our resources for our practice managers and our healthcare professionals are more limited. The Royal College of General Practitioners has a wonderful Green Impact for Health program that I love. There's a nurses drawdown series with a number of neat guidelines for things that nurses can do in their practices in healthcare offices. The American College of Physicians has a nice climate change toolkit you can print out and place in your waiting room. And I'm going to talk a little bit more now in my last couple of minutes about My Green Doctor, which is available at 2 websites, mygreendoctor.org in English and mygreendoctor.es for our Spanish preferred healthcare professional colleagues and patients. Next slide. The benefits of going green, including saving money by lowering overhead costs. One office using our system is saving $1,500 per doctor every year. It decreases the use of energy, water, chemicals, and other resources, improves office teamwork and staff morale. Our colleagues in the office love to work in an office that's working on these topics. A better patient office experience, as Andrew pointed out, a better public relations profile and patient trust is engendered, creating a healthier office, encouraging wise choices by our patients and family, very, very important. And finally, the opportunity to improve community health outcomes. Next slide. My Green Doctor is a comprehensive environmental sustainability and climate change program. It's evidence-based, written by health professionals with over 450 pages of content. It's suitable for any outpatient clinic, office, or facility. No study or science background is needed. Everything is provided. We have more than now 800 registered offices in 45 states and 80 countries. And as I said, save significant amounts of money for our practice. Next slide. You get a pledge certificate when you register at the website. It's available in 20 languages to hang up proudly in your waiting room and break room. Next slide. We have abundant brochures and other teaching materials for the waiting room. Next slide. We have more than 20 participating organizations that offer My Green Doctor to their members as a free membership benefit, free to the organization and free to the members. And for most of these smaller societies, My Green Doctor is their environmental sustainability and climate change program. And if your organization isn't involved, give me a call. We'll sign you up. It is free, truly free. Next slide. Okay, here's your assignment. Number 1, register at My Green Doctor, register as a partner society member, and use the Medical Society Consortium's discount code, MGD-MSCCCH, saving you $60 immediately and making use of the service entirely free. Adopt sustainability as a core value for your practice and brag about it. Be sure your organization has agreed to do this. If this is one of the things that you do as an organization, add 5 minutes of My Green Doctor to each practice meeting. We have a script for each 5-minute segment. So whether you huddle once a week or meet once a month, all we ask is 5 minutes. We plan to make small, steady improvements. Small, steady, slow improvements. We want a sustainable sustainability project, not something that ends after a couple of meetings. Provide patient brochures, posters, and other teaching tips, and qualify for our Green Doctor Office certificate that you're going to hang proudly, free if you're a Medical Society Consortium member. And finally, watch our 3-minute video on the homepage. It's not a very elegant video, but it tells you how to get going. Next slide. I want to thank you for going green today. Appreciate it. I'm all set.
Thank you so much, Todd. Our final speaker today is Dr. Armen Henderson, who is an assistant professor at the University of Miami Miller School of Medicine. And Dr. Henderson also serves as the director of health programs with Dream Defenders. And he is the founder of the Dade County Street Response Disaster Relief and Community Paramedic Teams. Take it away, Armen.
Hey, hello, everybody. Great. So I was originally teetering back and forth around whether or not I wanted to show my disaster relief guide. Are you able to show that by any chance, or should I just talk through it?
Yeah,
it's fine.
Yeah, pulling it up for you. Just one second.
Okay, great. So while he's pulling that up, I'll just say that I started an organization called Dade County Street Response. We basically focus on getting medical professionals outside of the hospital doors and into the community. It was founded in 2017 after Hurricane Irma actually, came through Miami-Dade County. What we found was that the organizations that were tasked with basically responding to vulnerable communities were not doing such a good job. Those being, the federal government, the Red Cross, and things of that nature. And this is in line with what we've seen in the past, particularly during Hurricane Irma. And so we can go to the next part of the professional disaster relief guide. So basically, we started this disaster relief team after individuals in the community basically identified that this was something that they needed to do. I live in Miami, Florida. We go through hurricanes every year, June through November. And so community members actually surveyed thousands of people, and they actually said that they wanted a disaster relief team that was medical professional led and that was focused within the community as well. And so, we started this thing in 2017, the disaster relief team. It's part of a larger organization called the Community Emergency Operations Center. And so we've been responding to communities since 2017, not just in Miami, but all across the United States and across the world as well. We've served over 250,000 households worldwide, and our model right now we're operationalizing. So as part of the Climate and Health Equity Fellowship, the inaugural class that just finished as of the beginning of this year, my task was basically to create this guide particularly for medical professionals to figure out how they can be involved. So why is there a need? Again, I talked about Hurricane Katrina, and after Hurricane Katrina, the National Advisory Council basically said that the federal government doesn't do a good job of responding to vulnerable communities. And every time there is a disaster in the vulnerable communities, every time, there's disparate responses, there's increased morbidity and mortality, and it's a cyclical nature. They put forth, recommendations to the Federal Emergency Management System, and yet those points are slow to be enacted. And so it is up to the community and up to us as medical professionals to connect with the community. And so this is what really this guide is about. You can go to the next slide as well, to the next page. Within that, not just the federal government doesn't do a good job, but also hospitals and traditional systems, sometimes even embedded in the community, don't do it. Medical systems in the community don't do a good job of responding to vulnerable communities, particularly during disaster as well. And so the reason to start a disaster relief team is really to educate about the effects of climate change and the effects that it has on patients and their health, which we know but also to decrease utilization of inpatient services during crisis triage. Hospitals become a focal point for an influx of patients during disaster. And so using the community organizations and community, infrastructure to mitigate those effects, I think is very important. Advocacy needed for change in public health policy, both on the federal, state, and the local level is very important. Education of vulnerable populations about preventable deaths, particularly during disaster, and equitable resource allocations of hospitals and medical anchor organizations located, particularly in vulnerable community, which is the majority of large medical centers throughout the United States. So what is required? The main thing that is required is relationship building through mutual benefit. The most important part about starting a disaster relief medical team is building relationships with community organizations that are already serving the needs of low wealth zip codes. And those are the ones that really focus on the social determinants of health, whether it be those that are fighting for a livable wage or fair housing, or access to medical care and things of that nature, connecting with those organizations and building relationships with them early on so that when disaster hits, you can focus particularly on the populations that they serve, because those are the ones that are going to be most impacted by what's going on. Each community organization in our coalition, which is called the Community Emergency Operations Center, again, Dade County Street Response is the medical arm of the Community Emergency Operations Center, which is a coalition of organizations. It's so tight knit that we have MOUs with each other that allow us to freely share information, grants, and other resources to quickly respond faster than the federal government, the state government, and the local government in most cases to impacted populations, and develop similar relationships with surrounding anchored institutions as well. What else is needed, you can go to the next part, is about training medical professionals to be organizers. Physicians and other medical professionals need to learn how to step outside of the institution, in which we heard, there was one community, pediatrician who I applaud, definitely is needed to step outside of the institution and into the community, knocking on doors. As part of a campaign to end youth incarceration was the first time I started organizing with Dream Defenders. And it was really when I started learning about what goes into organizing. And as employees of hospitals, which is the majority of physicians in the United States, in low wealth communities, we as physicians often see these populations more as patients than as people with complexities that affect their health before they show up to the hospital. And so the Dade County Street Response Disaster Relief Team was created as a result of thousands of people who were surveyed within the Miami-Dade community who wanted access to medical professionals during resilience efforts. And so some of the other things that we offer as a community organization are a street medicine team, which does weekly wellness checks and serves as case managers for unsheltered populations in Miami-Dade County. We do monthly Stop the Bleed and CPR workshops in areas experiencing the most gun violence. We do alternative to 911 mobile crisis response team that is just launched this month. We have a sobering center that's coming soon to decrease hospitalization, incarceration for those that have alcoholic intoxication, and it's going to decrease hospital utilization as well. And then we also launched a free urgent care as well. And I want to say that all these things are outside of the institution that I work for. They were started while I was in residency, and they are completely supported by community funding and grants as well, all outside of the university. And so some other things that I think are important as well are that these resources should be fully, resources in the community should also be fully investigated before a disaster occurs. Like I'm talking about resources on a state and federal and a county level as well. Because a lot of times there are resources that exist for our populations and our people, particularly during disasters, that are just not available or they're not talked about enough in the communities that need them most as well. So doing a critical appraisal of the resources that are available during disaster is also important too. Establishing a strong volunteer base, I think, is very important. Next page. And then determining the area with the greatest need. Which, you can just look by zip code. You can find those that are low wealth zip codes or that have the lowest life expectancy, and you can focus on those zip codes to get the greatest impact that you need as well. So again, the disaster relief team, the Dade County Street Response Disaster Relief Team is the medical arm of the Community Emergency Operations Center. And we activate during disasters They can be man-made disasters. They can also be hurricanes, which occur in Miami cyclical every June to November. And we act as a safety net for those that are most impacted during disaster. Determining the necessary response, next page. In February 2020, the CEOC, our Disaster Resilience Network, was activated during COVID-19 because we felt that it was a similar disaster that was going to affect similar populations. And as part of that, we trained hundreds of volunteers. We responded to thousands of individuals. And then we later focused on unsheltered populations here in Miami-Dade County. The majority of that work that was picked up in a documentary that's now on Netflix. It's called Convergence in the Crisis, that you should check out if you can. So lastly, in summary, medical professionals are an integral part of disaster response, especially in communities that are already bereft of access to medical care. And professionals like us need to be accessible to the community before, during, and after crisis to kind of help them navigate the medical needs that they may have during crisis. The disaster relief team is the medical arm of the CEOC. It does not operate in a silo. We share information, data, and resources with each other, and it's also outside of the university too. And realizing that the medical professionals on this call may not have similar infrastructure, I recommend starting with where you are, with what you have. If you work in a clinic, how can you use that information, to make that clinic a disaster response ready for the community? If you work at a safety net hospital, how are they prepared to respond to vulnerable populations outside of their doors during crises? And does the emergency response of your anchor institution or center, does it center people who traditionally lack access to resources? And if not, how can they? And these are questions that are good places to start, but as medical professionals who care about poor and working class people, particularly Black and brown people experiencing cascading disasters, the worst thing you can do is nothing. And so I'm looking to actually publish this in a major medical journal. We're looking now. So if you know of anything, let me know. But yeah, happy to bring it back over to the rest of the individuals. Thank you.
Hi.